Hi everyone, my name is Easton, and today we're going to be talking a little bit about the heart. More specifically, we're going to be talking about the circulation that provides the heart muscle with its oxygenated blood. In order to start our discussion of how the heart gets its blood, we really have to start with how blood gets into the heart. Blood's beginning starts in the right atrium, which we can see generally right about here. The right atrium will fill with blood and fill into the right ventricle across a valve known as the right atrioventricular valve or the tricuspid valve. Once enough pressure has built in the right ventricle, the right atrioventricular valve will shut. Pressure continues to build until enough pressure has been generated, and then the pulmonary valve will open, forcing that blood from the right ventricle into pulmonary circulation. Once blood has undergone pulmonary circulation and become oxygenated, it will fill into the left atrium. We can see the left atrium generally right about here. The left atrium fills from that pulmonary circulation with oxygenated blood, and it will fill into the left ventricle. It fills across a valve known as the left atrioventricular valve, which also is called the bicuspid valve. Once enough pressure has been built, the bicuspid valve, the left atrioventricular valve, will shut, and once more pressure builds, the aortic valve will open. In order to begin our discussion of how the heart actually receives its blood, we have to talk about the aortic sinus. The aortic sinus is directly after the left ventricle, and it's how the coronary arteries are filled. Now, you may be asking yourself, there's blood in the heart. Why doesn't the heart muscle just use that blood to supply its oxygen? And this has to do with capillary beds. The inside of the heart contains no capillary beds and therefore cannot feed the heart muscle. So it uses the aortic sinus and the coronary circulation to provide the heart muscle with the oxygenated blood it needs. We can see that aortic sinus pulsating right there for a really good view. Once blood has flowed back into the aortic sinus and filled the aortic sinus, it will begin to fill into the coronary arteries. There is both a left coronary artery, located generally here, and a right coronary artery located over here. If we take a look at our heart model, we can see that there is circulation going all around this heart. The right coronary artery, coming off right over here, right over here, you can see filling with blood, will give rise to the marginal branch of the right coronary artery. The right coronary artery will then continue to travel posterior around the heart, where it will usually give rise to the interventricular branch of right coronary artery, also known as the posterior interventricular branch of right coronary artery. This artery, the interventricular branch, posterior interventricular branch, is what determines heart dominance. If this posterior interventricular artery comes off of the right coronary artery, then it is considered to be a right dominant heart. While if it comes off of the left coronary artery, which is less common, it is considered to be a left dominant heart. Now we can talk a little bit about the left coronary artery, which we have already a really good view of here. The left coronary artery rapidly branches into two different arteries to supply the rest of the heart with blood. The first branch is the anterior interventricular branch of left coronary artery. We can see that descending the anterior side of the heart here. The other branch becomes the circumflex artery of the heart, which we can see wrapping around back here. This circumflex branch of the left coronary artery is going to provide much of this left side as well as some of the posterior aspect of the heart with oxygenated blood. Now that we've talked a little bit about the heart, where its blood comes from, and how it gets its oxygenated blood. I hope you guys have a great day and learned a little bit about the blood flow to the heart.